Hello and welcome. Today we are here at Institute of Urology and Kidney Diseases in Sonapur, Guwahati, and we have with us Dr. Arup Kumar Nath, who is the head of Urology and Robotics of the Kidney Hospital in Sonapur, Guwahati. Welcome to our show, sir.
Thank you.
So, sir, as you are a urologist, so the very first thing I want to know from you, like how does a urologist differ from nephrologist?
If you say that urology and nephrology, these are two different branches. Nephrology is a branch of medicine, super specialty branch, and urology is a branch of surgery. So, basically what is surgery? Department of surgery is the specialist who deals with all those surgical problems, like the diseases which can be cured with operation, surgery. Or medicine side, that is it's a big branch where the patients are treated mostly with medicines, and it's a specialty branch. But nephrology is a super specialty. After doing MD in medicine, you go for super specialty in nephrology, and after doing specialty in surgery, MS, after that you go for super specialty in urology, that is MCH. So, basically the nephrologist, they deals with the medical disease of the kidney, only the kidney. And urologists, they deals with the diseases which are from those organs which either produces urine or handles urine from the kidney to outside. So, it encompasses all those organs starting from kidney, the ureter which transports the urine from kidney to urinary bladder, and then urinary bladder which is a reservoir where urines are collected till the person feels the urge to pass urine. Then the urethra and the external genitalia in females and male, these are the part which falls under the urologist, and the diseases which are cured with surgery of all those organs, it is done by urologist. And all the medical diseases like kidney failure or kidney infection, these are the diseases deals by nephrologist. So, nephrologist a medical branch related to diseases of kidney, urologists are surgical branch related to the organs which either produces urine or handles urine.
So, sir, as IUKD is Northeast India's first kidney dedicated hospital, so like what are the services provided at your hospital?
So, all those diseases like which falls under nephrology and urology, these are the diseases, and all those patients, they are treated in kidney hospital, IUKD, Guwahati. So, the idea behind coming up with this hospital, which started in my mind when I was a super specialty student at Ahmedabad. I got all India 4th rank in super specialty entrance, and then I got the opportunity to study urology in one of the most prestigious institute in BJMC Ahmedabad. At that time, I saw and could feel that people from all over India, they come to Ahmedabad to get treated for so many problems, and the main reason behind was dedicated hospital. So, they had hospital for cancer, one hospital, for heart, one hospital, for kidneys they have 2 hospital, and for females they have hospital, for orthopedics they have one dedicated hospital. That is the reason why their quality of care is very high, and people from all over India, even I treated lots of patients from even Assam and Northeast while studying there at Ahmedabad. So, it was the main concept was a dedicated hospital where the certain kinds of diseases are handled. So, at that time I thought if possible, then I will come up with a hospital. It was a dream, but when I landed in Guwahati, and gradually I felt the same thing, that we did not have much hospitals to give the care for ever increasing patient in the field of nephrology and urology in Northeast India. So, after working for around 6 to 7 years in different hospitals in the city and different hospitals in entire Northeast, so I moved around with my associates, assistant, to see patient, to treat patient, to operate patient in different parts of Northeast India. Then gradually I got the confidence that if I come up with a hospital which will only deal with urological and nephrological problem, then it will be good for the patient, because they needed to go outside for quality treatment outside. And while a patient go outside, the treatment cost is high in bigger metros. At the same time, the patient who will be traveling, there will be 2 to 3 people will be traveling with them. They will stay in that place for maybe months, sometimes for years, for the treatment. Like for kidney transplantation, if a patient travels, it takes 3 to 6 months for the entire treatment. So that adds to the cost. So at that time, I thought, and I started developing my team. Now we are 5 urologists working together. And when I decided to go with the hospital, so I searched for a place which will be like little less polluted, and there will be not much of traffic jam, and it will be easier for the patient to locate and to stay in the hospital premises. And as you know that in Guwahati we have hospitals, but we do not have much space in the premises of the hospital, so parking is a big issue. And when the patient will be coming from different places where to stay, so we decided that this place will be ideal for that. Initially we faced lots of problem because it is outside the city. For manpower, even for the patient, we thought that it will be a little difficult, but gradually we saw that now patients are getting it much easier to come to our place, because there are ample space for parking. Then we have come up with a guest house inside the campus of the hospital, so the patient who will be coming, the attendants will not face much problem. They can stay at a very low price in comparison to other commercial guest house and all, so the patient will be staying. And in this 2-year duration, we got lots of support from people from Assam, Northeast India. Then some patient from mainland India also came for treatment here. And during these 2 years, as I have already said, we have come up with the guest house. We are now going to start kidney transplantation. Our blood bank is about to be completed, and we installed the urological robot in our place, and we started the full-fledged ICU. So in 2 years' time, with the blessings of Almighty and the support from people of Northeast, the first dedicated kidney hospital of Northeast India could be realized, and we could run the show for little more than 2 years now.
Okay, sir, I would just like to continue with you. Like, as you said, IUKD is providing high-tech robotic or laser treatments to the patients. So, with that, do you think like providing such high-tech medical facilities, does our local patients need to go out for top care, and like what other facilities are being provided for the patients?
The idea behind coming up with the kidney hospital was to give world-class treatment at affordable price locally, at an environment which will be there, it is treating the patient at their place only. So in that, I think we got succeeded in these two years, little more than 2 years time. And as you have said, that we are having now world-class lasers and robots. Robots, just we have started few months back. Lasers, I started laser treatment in the year 2011 for the first time in Northeast for kidney stone. Then in the year 2015 for prostate also, I started prosthetic laser in the year 2015 for the first time. Now we have done thousands of patients operated by lasers, and in kidney stone, and in prostate, in bladder cancer, in stricture disease. So many advanced things have been already done, and now it will be a proud moment for IUKD, for people of Assam and Northeast, that people from outside, like from people, urologists from outside Assam, they are coming regularly for getting trained under me. Even we have the 20th training program for urologists scheduled for tomorrow and day after. 4 urologists from different parts of country will be coming to get trained for laser in urology, for prosthetic laser, for stone laser, which is totally unprecedented for Assam. Earlier we needed to go outside to get trained. Now people from outside Assam coming for getting trained under me. And it is a very proud moment, and at the same time I am being invited to different parts of country to go there to demonstrate, to perform in front of demonstrate live in front of urologists. So the next program will be on 20th at Ahmedabad, where I got trained. Now I am going to train them. So because we have started very early in the field of lasers in urology, and we have done thousands of cases. Now the experience is very high, the result is very good, and that is the reason why we are recognized. And in the field of robot, because earlier for robotic treatment people needed to go outside. Now for urological diseases, because as you will be knowing that robotic operations, maximum robotic operations are done in urology. Around 70% of robotic cases are from urology. So if we want to give world-class treatment, then we need urological lasers, robots. So we did not have earlier, but a few months back we installed and we operated few cases successfully. Now with that we are now nearly complete. So kidney transplantation is an issue here. The number of kidney transplantation which are being done at this moment in Guwahati and in Northeast are not at the rate which should have been there. We need lots of more kidney transplant program in Northeast. So here we are going for it, and maybe in the coming few months we'll be able to do the first transplant in IUKD. So that is another development. And as you have said, the other treatments in addition to robot and lasers, we are having treatment for like for nephrology we have dialysis facility, 24 hours dialysis, and in urology we are treating all those kidney stone patients with advanced treatment. Smaller stones are done with laser, as we have already discussed. The advantage is there is no bleeding, no pain, no cut, no stitch. So patient can walk in, walk back same day. Most of the patients are discharged same day. So that that adds to lots of comfort for the patient and cuts down lots of cost, because loss of working hour is a big problem nowadays. The attendance staying with the patient is a big problem nowadays. So if you can treat patients same day and going back same day, walking is a big achievement, and that is possible at IUKD with lasers. And then we have like treatment for prostate, as we have already discussed. For prosthetic treatment, urologists from outside Assam coming for getting trained, and that is a regular affair now here. And after that, the urological cancers, which are again increasing in our place. So here we started doing urological cancer surgery laparoscopically in the year 2011. That is the year I started my practice in Guwahati. So from that year itself, we started doing laparoscopic treatment for urological cancers, be it either kidney cancer, urinary bladder cancer, prostate cancer. So nowadays we are doing with robot. So those patients who can afford can go for robotic surgery. And another treatment which we have started recently is sexual issues. So IUKD Sexual Health Clinic, we started in the month of April, and the need for a specific program for sexual issues was very high, demand was very high, and the patient were confused where to go, whom to consult. Earlier, like if a male or female, if they develop some sexual issues, they are shy, they are depressed, they are frustrated, sometimes they commit suicide, they get separated, husband wife, because of this kind of problem. They do not know where to go, how to go, and whom to consult. So we come up with this center, and in last 7 to 8 months we have consulted nearly 1,000 cases, more than that I think, and lots of patients are getting benefited because all the scientific treatment we are providing, and we are maintaining the secrecy of the patient. And at the same time, out of 4 urologists are trained for this to address the sexual issues, and most of them are treated with medical treatment, and few patients they need some minor procedures and some major procedures also, and we are doing that. And I am happy that people are coming up nowadays. They are coming up, and they are getting the result. Earlier people are shy, they do not open up, but nowadays people are more and more people are coming. The young people, even escorted by their parents, and young couples. So as any problem can happen, anyone can suffer from any kind of diseases. So sexual issues also a regular disease, and it can be addressed, it can be treated. So the sexual issues treatment, that sexual health clinic is another addition. And kidney stone treatment, as we have already said, in Northeast kidney stone is a big problem. Otherwise also 15% of general population they suffer from kidney stone. Northeast, the kidney stone incidence is increasing, be it because of the lack of proper water in our hilly states. Second, we consume lots of non-vegetarian food, that may be another thing. And otherwise also because of high humidity, people from northeast, they always suffer some kind of dehydration. So these three are the causes, I think, because of which kidney stones are increasing every day. For that also, if we pick up the stones at a very early stage, it can be treated with medicine only. And this is the reason why even for urological cancers, for prostate problem, for kidney stone, for sexual issues, if we detect the disease early, it can be very easily treated, sometimes with medicines only. But the same problem, it gets delayed, then we cannot offer treatment, we cannot offer cure, or it becomes very costly. So to increase that awareness in Northeast, after the hospital was established a little more than 2 years ago, we organized 168 free health camp. The last was yesterday, 168 camp. So in those camps, I always try to increase the awareness of the people to get their health checked up. If they are developing some kind of problem, then they need to go to consult the urologist, and they need to go to proper consultant, and before going outside, they should consult locally. Then they will be guided properly. So it's not like that if someone goes to some hospital outside, they will get the best treatment. Sometimes it may not be possible. There may be one or two very good consultants, but our patient may not go and meet that same people there. So they can come to consult the proper consultant before going outside. So this kind of awareness, or like it will be very surprised to know that Northeast is now the cancer capital of India. So maximum cancer cases are detected in Northeast. Assam is also part of it, and it is little scary also. Government coming up with cancer hospital every district of state of Assam, which is not seen in other states of India. This is the reason why, because cancer cases are increasing. The main cause for that is tobacco intake. So during our health camp, I always try to increase that awareness about the causes of cancers increasing in our place, and the need to stop all kind of tobacco, alcohol, these things. So in our health camp, I specifically make it a point to inform those people that see, these are the things coming up very badly. So you need to stop. You need to encourage young people to not to use those tobacco and other products. At the same time, your time to time you get your health checkup, regular health checkup. So these are the things we are doing from IUKD in these 2 years.
Okay, so like now I would like to know, maybe we are aware of very limited type of urological diseases. So would you like to please say what are the different types of urological diseases?
As I have already said that kidney stone is a big problem, urological cancers. Then there are some issues like kidney failure that falls under nephrologist category, then blockage of the kidney called PUJ obstruction, and there are some other issues like urinary problem of female, burning micturition, then unable to control urination. This is another very big problem for the females. They are very shy, they do not know whether it will be treated or not. While coughing and sneezing, urine gets leaked. That can be completely treated. 70 to 80% with medicine, and to 20 to 30% people, they need surgical treatment. That's a very like simplified surgery, can be done very easily, and sometimes we do take care basis. So leak of urine, then burning micturition of female, these are very common issues which can be easily treated. So I urge the female who are suffering, please do not suffer silently. Come up, we have solution. So for females, this is again very big issue. Then for males, elderly male, that prostate problem, inability to control urination, then going to pass urine again and again, straining at urination, waking up so many times at night. These are issues for males. So urinary problem of male, female, kidney stone problem, cancer problem, kidney failure problem, and then congenital issues like blockage of the kidney. These are basically diseases which falls under the work capacity of urologist and nephrologist.
So sir, as IUKD is providing robotic surgery and also laser surgery, so like what is basically a robotic surgery, how is it performed, and like what are its advantages, like along with the laser surgery's advantages also?
Okay. So these are actually very advanced kind of treatment. When robotic surgery is done, like there may be some impression that the robot, as we used to see in some movies or in sci-fi movies, like the robot will do the surgery. It's not like that. It is some robotic instruments. So the surgeon will control surgeon will not be by the side of the patient, he will be at a distant place. So that is the reason why a surgeon sitting at Delhi or maybe at New York can operate here also. So this is the advantage. So online control from the surgeon console to the patient. So a surgeon will get a 3-dimensional view of inside of the patient, and he will have some like virtual instruments. So when he performs the surgery in that console, 3-dimensional console, the same movements will be followed by the robotic instrument. So it's a kind of master slave technique. Whatever the master performs, the slave will just imitate and follow that. That is the reason why surgeon will be very comfortable sitting and performing the surgery in a computerized console. So it will be very fine, precise. So that same thing will be followed or imitated by the machines in the patient. So the surgeon's hand will not go inside, or the instruments, unlike the regular laparoscopic instruments, robotic instruments are very flexible. So it will be very easy to operate inside at some critical areas where laparoscopic you cannot perform, or it will be very difficult or time consuming, where the robotic surgery or with the robotic instrument you can perform it very easily. So the results will be better, it will be precise, it will be like less blood loss will be there, it will be less time consuming, so infection will be less. So a patient have lots of advantages while performing the surgery with robot. So once experienced, the surgeon can do like more surgeries. While he will be doing with laparoscopic instruments, he will be fatigued. So surgeon fatigue will not be there. Okay. So surgeon will be very comfortably, he will be sitting. So he can concentrate for longer surgeries much better in comparison to laparoscopic surgery. Well, he will be standing, he will be performing the surgery, at the same time he will be involved in assisting the guiding the assistant or the camera movement, so many things. Here everything done by computer. So it is a much helpful surgery for the patient. But again, in case of lasers also, as you have asked, for laser, like for prosthetic treatment, for kidney stone treatment or urological cancers, laser again is a very advanced technology, where for the same surgery, in comparison to conventional surgery, here blood loss will be less, the surgery will be precise. So the patient can come and go same day or maximum 1 day hospitalization. In some cases only there will be 2 days hospitalization, which otherwise if you do with conventional treatment will be 1 or 2 days added hospital admission. So that will lead to some inconvenience, some addition of cost, so which is not there in laser. So chances of blood transfusion is very less. So related cross transfusion related reactions or so many things, and again cost of transfusion, those will not be there. So blood loss is less, precise, early resumption of activity. The patient can move same day or the next day. He can join back his work within very short span of time. So there are lots of advantages for all those technology based surgeries now with robot or laser, and it is very helpful for the patient. Pain will be very less. So your need for painkiller will be very less. Antibiotic consumption will be very less. So these are the basically advantages of doing the surgery with robot and laser.
Okay, and like for a hospital, it is very much necessary that the place is well maintained. So how is IUKD providing that hygiene of the hospital, and like why do you think it's very much important for the patients also?
See, in kidney hospital, for any hospital, patient coming inside the hospital, if they get a very clean environment, they will develop a confidence in the center. And once you get the confidence of the patient, your treatment part become very easy. Once the patient submit on your capacity and capability, then it becomes very easier for us to give the treatment and to play. Like in cricket, if you play a natural game, chances of getting out is less. So if the patient is confident, then he will ask or she will ask less questions to you. So if they ask lots of questions, then you become little hesitant or guarded. Then you cannot do the surgery the way you would have done otherwise. So getting patient confidence is very important. So here in IUKD, as you have seen that we are providing something for which the outside dust, not a single ounce of dust is coming inside. So hospital is very clean. We got cleanest hospital award for last 3 consecutive years. And and because of that, maybe the patient who are undergoing dialysis, where the patient immunity goes down, and they used to get infected from time to time, they used to get admitted to ICU from time to time, those patients who will be undergoing regular dialysis. So here at IUKD, it is very rare phenomenon. Those patients undergoing dialysis, they are not getting infected regularly because of the clean environment. As you can see yourself, that it is very convenient to put something covering your shoes. Without opening the shoes, you can come. At the same time, you are not carrying any infective material from outside. So it is little costly, but it helped us to maintain the hygiene and cut down the infection by leaps and bounds. And because the patient who are undergoing dialysis, and we are planning for kidney transplantation, where we need a very strict hygienic environment. So we are practicing, and I think we have got succeeded also for that, to maintain a clean environment. So if 6 months or 1 year down the line we get the permission to go ahead with transplant, then by that time, as you have seen now also, the maintaining hygiene will be much easier, and by this time all our employees, they are also trained to keep the hospital clean, and it will be easier for the patient, because after transplantation we need to give some treatment which will bring down the immunity of the patient. The patient's defense will go down, because otherwise a kidney from other patient will not be accepted. So if the patient's defense is very strong, it will reject the kidney. So at that time, we need to bring down the immunity, we need to bring down the resistance, the defense of the patient. At that time, a very small virus or bacteria can kill the patient by getting infected. So if we can maintain this kind of environment at the time of kidney transplantation program also, I feel and hope that infection will come down.
Okay. And sir, like as you said earlier, you'll be like, you go out for conference or for giving training to the budding urologists. Yes. So like, how do you manage your personal time with every patient that like who's seeking for your assistance?
So for that is the reason why I developed a team. So I am not operating each and every patient. So I am here at IUKD, we are 5 urologists. So one urologist will do certain kind of cases, and that brings the best out of him, and patient will be getting the best treatment, because one urologist will be doing the same kind of surgery every day, rather than one urologist operating every kind of patient. So that is the reason why people are getting good result, and at the same time, because I have done thousands of cases of prostate surgery. So now I am being invited to train urologists outside. People are coming to get trained here at IUKD, and we need to continue that. And we, as you can say that there are only 4 or 5 institute level kidney hospital in entire country, and we are among them. But in coming days, we are hopeful and ambitious that it can be the best kidney care destination of the country.
Okay, sir, like as you said just now, IUKD is providing training to young urologists. So like, how are the young urologists are being trained in IUKD?
So like tomorrow and day after, we have a program called TIPS. Training at the IUKD for professional skills. So they will be coming, and I will discuss, and I will first I will discuss about the key points which they need to look after before starting operating on those patient with that gadget like lasers. So I'll first discuss, then certain kind of important points I'll explain. After that, they will go to the OT with me, and they will see how I operate. And during operation, that is the most important part, that I will show them the crucial steps. The rest of the things they can do, because they are also trained urologists, and most of them are senior to me even. So I'll train them where the crucial points are there, which are the points where they need to give maximum importance, and if they can master that, if they can control that, then it will be easier for them. And at the same time, there are points where the operation may go wrong, where the complication may arise. So I will train them to handle those situations if it occurs in the OT, how suddenly they prepare themselves to handle those kind of situations. So it helps, because like see, surgery is an art which are learned, then it is passed to younger generation. If like I develop something and I do not train, then it will go with me. One day I will again go from this world. So if I do not train people, then the skill I have developed will be wasted.
Sir, as IUKD is a very sophisticated hospital with like high-end facilities for the patients. So like how is IUKD accessible for the economically weaker sections of our state?
Yes, that was again another direction which we thought earlier, and we are trying to address. There are a few points. Like first, a patient from interior place coming to Guwahati is very difficult sometimes, and staying here and meeting the required urologist and planning the surgery, and if they get the surgery done the same visit, these are things where we can cut down. We are trying to cut down that by going to the periphery. I go for free camps, and my colleague urologists, they go for regular visit. So if you see every district, there will be 1 or 2 urologists from our center will be there. So the patient can initially consult our urologist at their place, get the investigation done, the surgery plan, they will come for the surgery. So that way we are cutting down the hospital stay and stay outside their native place, and stay in a costlier place, because Guwahati will be anyway costlier to a district place. So we are trying to do that. Second, once we operate the patient here, then the patient go to their place and our urologist will be there, and not all of them will be needed to come to IUKD for checkup. So that again will cut down the cost. Thirdly, we are communicating with the people over we are like using the social media platforms. Our YouTube channels are there. Our patient can contact us with WhatsApp. They can whatever, like one patient saying that my urine is having some blood. So we do not know whether it is serious or not. We'll tell that collect the urine in a bag, take a photograph and WhatsApp. Then we see, okay, this is normal. So we can see. So we are using all those platforms for the benefit of the patient. And another thing, we are providing patient all those advanced treatment also under Ayushman Bharat scheme. That is the biggest insurance provided by government to the economically weaker section. So here the facilities are available. Then the insurance companies, we are getting the tie-up with few companies, and fewer other companies almost nearing at the closure phase. And at the same time, we are on the verge of completing the tie-up with the PSUs also. So this is the way that our urologists are available locally at the periphery, and they can be checked up, they can be like investigated properly, cutting down the travel to our place. And we try to treat the patient when they come the same day, and we try to give discharge the same day or the next day. That is the way also we do the treatment very promptly to cut down the hospital cost. And another thing is Ayushman Bharat and the insurance. So these are the ways how we cut down the cost.
Okay, so like as we have come towards the end now, it was really grateful having you. Thank you very much for giving us your precious time amid your busy schedule. And with this, we come to the end of our today's program. Thank you for watching.
উত্তৰ পূৰ্বাঞ্চলৰ একমাত্ৰ উৎসৰ্গিত ইউৰোলজিকেল ৰবটিক সাৰ্জাৰী সেৱা এতিয়া গুৱাহাটীৰ সোণাপুৰস্থিত কিডনী হস্পিটেল IUKDত। ইয়াত উপলব্ধ অন্যান্য চিকিৎসা, কিডনীৰ পাথৰ আৰু প্ৰস্টেট গ্ৰন্থিৰ সমস্যা, কিডনী বিকল হোৱা, প্ৰস্ৰাৱৰ সমস্যা, ইউৰোলজিকেল কেঞ্চাৰ, ডায়ালাইচিছ সেৱা আৰু সকলো প্ৰকাৰৰ যৌন সমস্যা। লেজাৰমেন ডাক্তৰ অৰূপ কুমাৰ নাথৰ নেতৃত্বত উত্তৰ পূব ভাৰতৰ একমাত্ৰ কিডনী হস্পিটেল IUKD কেৱল আপোনাৰ সেৱাৰ বাবেই উৎসৰ্গিত।